Welcome back here to Good Company. Well, proper dental care is important at all ages. The Foehr Group offers quality, convenient dental care for the whole family. And joining us tonight with more, Dr. Robert Wolf. Thank you so much for joining us.
Well, thank you for having me.
Now, you focus a little bit more on some restorative, aesthetic stuff, implants. I know you said you just got back from a conference, but
Right.
tell us a little bit about your background and what you specialize in.
Well, I'm a general dentist.
Okay.
I've been practicing for 33 years. That almost pains me to say that. But, 33 years, so I've had a lot of experience in general practice, family practice. So I kind of do a little bit of everything, but I work at the Foehr Group, so we have another dentist, Dr. Jim Weiss, or James Weiss, and we also have an orthodontist there.
Oh,
so
okay.
we have kind of a group practice. But I do focus a lot on aesthetic restorative dental implants, which is a very hot topic now, because we're able to, in many cases, replace the teeth all in one day.
Wow. Wow.
Yeah.
Wow. Yeah, you said you just got back from a conference and you were talking about this computer-guided surgery. Tell us about that.
Well, it's beautiful because, like we were just talking, medicine has done this for years, you know, with the robotic surgeries. You don't usually want somebody now slicing you open if you don't have to, right?
Right.
You'd rather have somebody kind of go in and very precisely know and be able to see with the aid of a computer and large screens. Same thing is true with guided surgery now. It's much less invasive. We kind of begin with the outcome in mind.
Okay.
And so it gives us much more predictability, which equals success.
Okay.
And I think that's really what it boils down to. So it's much more comfortable for the patient, less downtime.
Okay.
And you know, we can, you know, really just go in and do this, you know, pretty much with the aid of a computer.
Wow, that's amazing.
Yeah, it is amazing, isn't it?
You talked about replacing your whole teeth in one day. How does that?
Well, my background, I worked for several years in Chicago with a group that all we did was dental implants, and many times we could have somebody come in and first thing in the morning, literally, years of neglect could be wiped away in one day.
Wow.
And they would walk out that day with teeth. And we are able to do that here as well because of that background.
Wow, amazing, amazing. I noticed something here. Teeth in a day. Is that?
Teeth in a day. That's you've probably seen that if you've been in the flight magazines. There's groups all over the country that do this teeth in a day type of thing, and literally it's just like it sounds. You come in the morning. You can have teeth or no teeth, and you know the teeth can be removed, implants placed, walk out with teeth that are, you know, permanent.
Wow.
Yeah, and then, I mean, there's more to the story. I always tell people there's more to the story, but that's pretty much it. It's one big day of surgery, and the rest is just all follow-up and maintenance.
How soon can you go back to work after something
Most people, surprisingly, go back to work within just a day or two.
Oh, wow.
And most people don't have as much, you know, trauma and pain as you might expect. In fact, it's kind of remarkable. For a long time, I had to interview those patients afterward, before and after. And coming in, they were all very, you know, anxiety-ridden.
Yes.
But afterwards, they just couldn't believe that, you know, said, I didn't have any pain. I couldn't believe it.
Wow. Are you overall seeing people are taking care of their teeth more or less? I mean, if you've worked in the business a long time now.
It's kind of remarkable because I still think that there's a lot of dental disease. You know, coming from, I grew up in Iowa on the farm, you know, middle of nowhere, you know, and went to the University of Iowa. But so in the time that I went to dental school and some of the places I've been, we've seen, you know, some pretty bad situations. But working in the implant arena, I saw people that had avoided the dentist for many, many years, you know, 10 years plus. And so consequently, you know, things got a little bit out of control. So it's kind of remarkable to see the amount of dental disease that's still out there, and mostly a lot of it has to do with fear or thinking, embarrassment. You know, saying, oh gee, I'm embarrassed that I haven't done this. Well, the beauty of it is we've always seen something worse. Always seen something worse. No matter what. Because I can't tell you the number of times people say, oh, you've never seen anything this bad. And I said, trust me, I've seen some pretty bad stuff. I
know some people that have had teeth pulled out, you know, that have gone bad in the back, and they don't get implants, they don't get replacements in there. Is there, how many can you take out without putting implants in? Or?
Well, really, one can be too many.
Really?
Because it's kind of a cascade event. You take out one, and then things start moving.
Okay.
You take out two, things move a little more. The more you take out, the more it moves. If you know, a lot of times you'll develop, you know, some sort of periodontal or gum disease. Teeth start shifting, moving around. The next thing you know, you've got this big mess and you can't chew properly. You know, facial support begins to be lost. Because you lose teeth, you literally, you know, your nose and your chin get closer and closer together.
Really?
Oh, yeah.
It's important. Does health insurance, does that aspect scare some people away too from?
Cost has been a factor. You know, there have been a lot of changes in that arena, not from so much in the insurance arena, but from a standpoint of there's a lot of financing available to help people do those kinds of things. Because let's face it, it is a big investment. Yeah. But it's like priceless, like the commercial says.
Yeah, and we've done stories about school kids. I mean, any kind of dental disease, anything like that. I mean, it's the #1 reason for sick days for kids. It just leads to so many other things people don't realize.
There's been so many studies over the last 30 years on, you know, gum disease or dental disease and heart disease, all these kinds of things, and yet it's kind of one of the things that people, it's kind of literally out of sight, out of mind. If the front teeth look pretty, you know, who cares, right?
Think about it, yeah.
But there really is a lot more to the story.
All right, well, there's so much we can talk to you about. Doctor, thank you so much for coming by. And we want to remind everybody the Foehr Group is at 107 South Prospect in Bloomington. You can call them at 663-0433 or 1-855-SMILE-23, or go online, check them out at thefoehrgroup.com. Thank you so much for coming by.
Hey, thank you.
Nice to meet you.
Nice to meet you.
All right, we will be right back with Mark doing some exercise.
I'm at upper limits, scaling the 112-foot tall silo. Will I make it? We'll let you know after the break.